Welcome to the next segment of our learning series on team-based care basics. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. In this segment, we will provide recommendations and suggestions for how our care team might work beyond our clinic and into the community. The opportunity for health begins in our families, neighborhoods, schools, and jobs. Our opportunity for health exists before and after we need medical care. Whole person care is addressing not only the physical needs, but also the mental, emotional, and social needs of our patients. Whole person care is only possible when we extend our care team beyond our clinic and into our community. There are many factors that help determine how healthy a person or community is. These categories have been identified as contributing to a person's health. This data from Healthy People 2030 shows that clinical care only accounts for 16% of our health and health outcomes. The remaining 84% of our health is determined by non-medical factors, often called health-related social needs or social determinants of health. Social determinants of health are the non-medical factors that influence our health. They are the conditions in which we are born, grow, work, live, and age, and the wider set of forces and systems shaping our conditions of daily life, including economic policies and systems, development agendas, social norms, social policies, and political systems. Health-related social needs refers to the social and economic needs that we may experience that affect our ability to maintain our health and well-being. They are a result of our community's underlying social determinants of health. In healthcare, upstream interventions seek to reduce or diminish the causes of health-related social needs. They address the underlying policies and practices that contribute to social determinants of health. Upstream and midstream interventions focus on promoting healthy behaviors and prevention. Downstream interventions address health situations as they come up, including what might result from not addressing upstream or midstream factors. A downstream approach reacts to problems after they've occurred, while an upstream approach aims to prevent problems from happening in the first place. To advance health equity and improve the health of our communities, we need to focus on addressing upstream factors as well as providing downstream services. There is more information on how we might address and advance health equity in the Health Equity Basics Learning module. It provides an overview of addressing health equity, how to use upstream and downstream interventions, and actions we might take. A link to this resource is available in the description below. To help provide whole person care and to work upstream, our team should build relationships with the social service providers in our community and then actively connect our patients to these services to more effectively address the health-related social needs of our patient population. Assessing, monitoring, and addressing the health-related social needs of our patients is a key tool teams can use to improve health outcomes. Patient navigators can help connect patients with needed social services. The patient navigator should work to develop strong relationships with community services and be aware of all the services their community offers. Many patients receive referrals to different providers and services, including community resources. Closing the referral loop can ensure the patient receives the information or services they need, and that any important information resulting from the referral gets back to our care team. Another way to expand whole person care is to think beyond the staff in our clinic and consider what other team members from the community we might utilize. We can also deliver services in a culturally appropriate way according to the needs of the patients and connect them to other services in the community. And we can adopt an upstream approach, proactively working to avoid potential health concerns for our patients. Our team can also help support our community by hiring staff from the communities we serve. This can provide insights into the community and culture. We can recognize, respect, and support the diversity of our community. And we can make ourselves aware of the services available in our community and develop relationships with key organizations. Hiring staff from the community and staying connected with local organizations are key components of patient-centered and whole person care. In the Primary Care Team Guide under the Do the Work section, we can access the Learning module on Clinic-Community Connections. We can find out what our practice can do to better understand and represent the communities we serve while building lasting relationships with community resources. The calls to action for this segment include: research what social services are available in our community and build relationships with those organizations. Implement screenings to help determine our patients' social needs and patient navigation services to connect patients with available services in the community. And adopt an upstream approach, helping our care team address health needs more proactively. In the next segment, we will review the steps we recommended throughout this series to get started with designing and implementing a team-based care model that best fits our needs. Thank you for joining us.